Thank you very much, Dr. Dexter. The chair now recognizes herself for 5 minutes. Ms. Hunter, you mentioned several times about the challenges of information and training, and whether VA-specific providers had specific types of training that didn't happen in community care. But isn't that a failing of the VA?
So if we think about the training, it could be a failing of the VA.
Yeah,
It could
is
be a
it
failing.
just as, I've got 5 minutes.
It could be.
I just want a simple yes and no question. It's a failing of the VA. Agree, disagree?
We don't have the data, so we can't say where the failing is.
Okay, but is not the VA responsible for that? The VA can set the standards for community care.
They can.
Ms. Mobbs, can the VA set the standards for community care?
They absolutely can, that's correct.
And so, and you mentioned the training, you also mentioned the Red Report, and I think perhaps you might have some comments you wanted to make on testimony, so I'm going to give you an opportunity to clarify that.
Thank you, Chairwoman. So first off, I never said that they don't receive training, that's an inaccurate characterization of what I said. And I think it's really important, if we're talking about specifically data here, and I'm going to go where I'm an expert in, which is mental health. In the VA system, for example, we prioritized 2 performance metrics-based, data-driven therapies for post-traumatic stress disorder: prolonged exposure, combat processing therapy. Unfortunately, because that was a trauma-centered therapy, the majority of veterans left after 2.4 sessions, therefore wanting a different type of therapy that they weren't allowed to receive in the VA because they were given a PTSD diagnosis and qualification. And so unfortunately, other evidence-based cares like interpersonal therapy, community care providers are trained in, were unable to see those veterans, and they dropped out, and then we couldn't follow them. So all that to say, just because there is training in the VA doesn't always mean it's the right training, and to the chairwoman's point, you can absolutely receive care in the community set by the VA to ensure that they are evidence-based therapies to provide for veterans.
I admit that as a community care provider, as an ophthalmologist, I'm given a specific type of treatment for a specific disorder I'm supposed to address. So there were questions that may have been asked of other type of conditions that I did not need training from the VA for. And Ms. Knight, I'm going to ask you to comment, because you mentioned receiving care at the VA and care in the community, and you've heard how this specific training better equips VA physicians to handle either the PTSD or the variety of issues, but I didn't hear that in your testimony. So can you comment upon whether you thought that this training uniquely qualified VA physicians, and did you receive better treatment at the VA versus in community care?
My answer would be no, Chairwoman. No, I had 3 different accounts of VA providers, one of whom was a veteran herself, and all 3, again, I felt more like I was interrogated at times, questioned and validated on my combat service and what I had endured and drilled. I would also add that so many of our community providers out there deal with other patients who are similar in trauma exposure, such as our police and firefighters. So there are an array of providers, both in the VA and outside of the VA, that are more than qualified to meet standards. I just feel very strongly that, again, one, they need to ask the questions, but that can be resolved by the patient by understanding and being educated on who the providers are, whether that's ratings or reviews or anything of that nature. Right now, we are not given that choice. We're not given that option. We are told where to go. It's more or less being in the military. And if I may, if we're going to talk technology, I would love to see the transition of documentation from DOD to VA fixed first.
Kudos. As an Army veteran, I will say kudos to that. We've been asking for that. Ms. Newman, have you noticed any decrease in community care referrals for home care services?
Yes. In 2024, we noticed a marked decrease both within our agency and members across the nation.
And have you heard what the reason for the decrease in referrals would be?
There, in our particular visit, there was an extra layer of oversight and bureaucracy where their intent was to find reasons to reduce the amount of care authorized.
And I can tell you from my exposure, my talks with veterans, it was felt that they were encouraged not to send patients into the community And as a community care provider, it can be extraordinarily challenging dealing with the VA, even when someone is 60 miles away from a center that could give them care. And I think veterans do appreciate and like the care that they receive at the VA, but there is a reason why the Mission Act and community care exist. And the reason was because people were dying waiting for care at the VA. Ms. Hunter, do you know how much the budget for the VA has increased in the past 4 years?
Yes, I have that data right here.
Is it flat?
Yeah. No, the budget has continued to increase.
So the budget's continued to increase. We know community care is comprising about 40% of care now within the VA, but we also know they do it at about 25% of the cost of the regular VA. So I'm just going to say that, implicating that community care is a downward spiral for the VA and taking money away from the direct care system, I'm going to say that doesn't bear out by the facts when you look at the budget and you look where the spending goes. I also want to say that we keep talking about this as a fixed budget. And so if you have providers going to community care, they're not going to get direct care because the budget is the same and there's never any increase in funding. That's patently incorrect. I mean, there has been more appropriation dollars from Congress. This spring, Congress voted billions more into VHA medical services, $75 billion to be exact. So I think some of the arguments are poorly founded, although they sound very dramatic. So with that, I yield back my time as I too am over time.